Moving on here, I have a second paper from Journal of, Exotic Pet Medicine. So this is this is from the UK. This is also from this year. So this is looking at mortality outcomes based on ASA grade in avian patients undergoing general anesthesia. So mortality is, of course, death, unfortunately. So ASA grades are from the American Society of Anesthesiologists. So it's a classification system to assess anesthetic risk based on factors like age, comorbidities, or like what other diseases or health problems the patient has, and like their current reason for anesthesia. So I've actually pulled up this chart on the American Association of Anesthesiologists, or sorry, it's on the this is the chart from the anesthesiologists, but this is on the website of the veterinary technician specialists in anesthesia. So fantastic. VTSs in anesthesia and analgesia are wonderful. So effectively, for the people who don't know what ASA risks are, so class 1 are patients that are minimal risk. So these are young, healthy patients that have no obvious underlying disease, and it's usually for like elective procedures. So procedures that aren't having an immediate medical need. So things like elective spays, elective castrations. Class 2 are patients that have a slight risk. They have minor disease present, but the animals are able to compensate. So, really good examples here are neonates, so patients that are extremely young, geriatric patients that don't have any specific disease, but we assume that there's probably some minor organ compromise just associated with age related changes, and obese patients. So, these are healthy patients that need a procedure. So, these might be like your neonate that has to have. That is undergoing like a pediatric spay or neuter, which that's controversial. We're not going to get into that. Or your senior dog, or that has to have a lump removed, or your kind of chunky pet that really needs his teeth cleaned, and the dental disease is pretty gross. So we're not going to wait until the animal loses weight because the teeth are falling out. So those are all good examples. Class 3 are patients with a moderate risk, so they have obvious disease present. So their examples here are patients that are anemic, because anemia does change the viscosity of blood and it changes how well we can oxygenate. So, if there is an adverse event under anesthesia, the body's probably not able to compensate as well. Patients with moderate dehydration or fever, we generally try to correct moderate dehydration before going into surgery, but sometimes we just can't because there's a time sensitive procedure. So, for example, like patients with foreign bodies, if that, or a foreign body in the digestive system. So, let's say you have a dog who ate something dumb, or a ferret who ate something dumb, because we're talking about exotics, and we're worried that, there might be like a gut perforation occurring, or we just don't want to delay surgery for whatever reason. That animal could be dehydrated. Then, ideally, again, we rehydrate beforehand, but that doesn't always happen in practice for so many reasons. Patients with a low grade heart murmur, or, like mild cardiac disease, or patients that are really underweight, so patients that are emaciated. And this does complicate anesthesia. So, all of these conditions do make us change how we handle these patients under anesthetic. Then, our high risk class 4 patients are significantly compromised. So, unfortunately, a lot of our exotics that are coming in for elective procedures are probably within class 4 to class 5. Arguably, class 5, we tend not to do surgery on them unless we're really pushed to do it. Um, so class 4 are patients that they have severe disease, so they're severely dehydrated, they're in shock, they're uremic, so they have elevations of kind of like kidney waste products, or sorry, metabolic waste products that normally would be filtered out by the kidneys. They can be toxemic, so these can be rabbits that have enterotoxemia from a gut stasis. They have a really high fever, they have heart disease, but it's not well controlled. They have diabetes, but it's not well controlled. They have lung disease. So these are patients that are high risk. These are the patients that kind of make nurses sweat a little bit in general when we're dealing with them as anesthetic patients. And then our class 5 patients are extreme risks. So these are patients that they're unfortunately probably going to die with or without the procedure. So anything that's an advanced systemic disease that affects the animals, just our life sustaining body systems, are not working properly and they're severely compromised, or we have any kind of severe traumas, infection that's a constant threat to life. So patients that are septic, so patients who we know have um, like pyometras and they're septic. These are patients that are the highest risk. Unfortunately, we kind of expect these patients to not survive either within the procedure or immediately after the procedure. But if we don't do it, then they're going to die anyway. So these are really salvage procedures. So these are kind of our highest risk. These are the most guarded prognoses where the vet says, like, we can try, but no matter what we do, your patient, your pet's probably unfortunately going to die. So that's just to give you an idea of what these ASA scores are. So this study this study looking at kind of mortality based on ASA grade in birds, no one's really done a really good study on this before looking at data on does ASA score correlate, or does a higher ASA score correlate to these animals unfortunately having death as a complication from these procedures or immediately after these procedures, after a surgical procedure? So they looked at a lot of records, 1,820 anesthetic records over a 3-year period. So this is like a retrospective study where they looked back into records. They didn't just like do a bunch of surgeries for the study. They looked at historical data. Um, so a total of 81 patients. So just under 5% died during anesthesia or within 48 hours of cessation of anesthesia. Patients assigned an ASA grade of 1 had a basically 0% mortality rate, which is what we want to see. Patients with an ASA grade of 2 had also a very low mortality rate, so 0.6%. And then just to kind of compare, so I should have pulled this up before, mortality rate, canine, feline anesthesia. So our mortality rates in dog and cat anesthesia are very low. So this is from Dispomed, which is one of our anesthetic, I guess, supplier companies. We use these guys, throughout Eastern Canada. So it's pretty low. So overall, for healthy dogs and cats, mortality rate is approximately 0.05 to 0.1%, and probably around 1 to 2% for sick dogs and cats. So really, really small, which is great. And of course, they're talking about how poor health status. So ASA does correlate to increased risk of death, unfortunately. So I don't think they have references here. Do they have references? This is by an anesthesiologist, so we can trust this, even though this isn't like a journal. So let's jump back here. So still a pretty low rate considering, we're exotic, we do weird things. 3, 4, and 5 had mortality rates of 5.9, almost 19%, and then 50% respectively. So honestly, a mortality rate of 50% for ASA 5 patients is astonishing to me. These are patients that again they are going to die. So that's really impressive. I'd like to know if all of these patients were being treated by boarded surgeons or by doctors who are boarded in avian medicine. Anyway, we might see that a little bit lower down. I kind of skimmed this paper beforehand. So, age, sex, and weight shown to have no statistically significant impact on odds of death. And that's so important because age is not a disease, regardless of the species. We can see age related diseases occur, but age in itself is not a disease and is not necessarily a dramatic risk factor for anesthetic mortality. Weight is also important because sometimes clients will say to us, like, oh, but the animal is so tiny. I can tell you the smallest patients I've ever done anesthesia on were something like, oh gosh, how big was that hamster? I feel like that hamster, it was a dwarf hamster. The dwarf hamster was like 30 grams. Um, and then a tiny, tiny lizard, a Chinese water dragon that weighed something like 17 grams. And you know what? We had an IO catheter in. That patient was intubated. Body size doesn't necessarily correlate to an increased anesthetic mortality or morbidity. So anesthetic death or things that are associated with not doing well. especially when you have a team and you have staff that really know what they're doing with these tiny animals. There are absolutely things that we have to modify for small patients for anesthesia, but again, if you have a team that knows what they're doing, the risk of having adverse events during anesthesia are not necessarily higher. We certainly have limitations when these animals do have adverse events under anesthesia. For example, doing a CPR code on a dog is much easier just because of the size of the animal compared to doing a CPR code on a hamster because there's much less room for everybody to move and actually accomplish things. So it'd be really interesting again to look at. I'll see if I can find another study for a future date on CPR successes, CPCR successes based on patient weight. That would be really interesting. So most of these patients died following cessation of general anesthesia, which unfortunately, that is something that we do kind of appreciate when patients like they do okay during anesthesia, and you're like, we're just not recovering well. And then they just don't wake up or they have an arrest event and we, unfortunately can't bring them back. So their highest mortality rate was occurring between 0 and 3 hours post anesthesia, and that's pretty consistent with what I experience in practice, I would say. So they do go over just like kind of an introduction on inhalational anesthesia because that's most of the anesthesia that we're using in our patients is isoflurane or sevoflurane. I'm currently working with isoflurane. Um, and isoflurane does tend to be pretty well handled in birds. Birds have really extensive respiratory tract, so isoflurane is really wonderful in that, unlike older anesthetic gases like halothane, a drug like halothane is breathed in, and then the liver has to metabolize it to be excreted. Isoflurane is breathed in. It tells the brain, hey, you're under anesthesia. It's not that simple, but that's basically what it does. And then it's breathed out. So it actually isn't metabolized by any of our organs, and that's incredible. So isoflurane is pretty well tolerated in birds because birds have a really vast respiratory surface in their bodies because of their unique respiratory system. And I'm like losing my voice now. Not only can I stop yawning, but now I can't stop losing my voice. It's great. So, birds have a very vast, unique respiratory system, so they have a lot of surface area. So, in theory, that might help with their recovery. That might help with their very smooth inductions if we're using gas for induction, which is a big no no in most species because we are having nasty side effects from that. But in birds, not so much. So, that's really cool. And then they tend to recover well because, again, vast surface area for the respiratory system, so they're excreting it or exhaling it very effectively. So, yeah, so again, they're just talking about here inhalation anesthesia generally superseded parenteral anesthesia, so like injectable anesthesia. So even though we use things like pre-medication for surgery that's injectable, so things that are like pain management drugs, anxiolytics, other sedatives, just to help make the anesthesia more balanced. Um, yeah, that's perfect. That's exactly what I would expect. Sedation has been advocated to allow for immobilization without dose-dependent side effects of yeah, okay, that's great. So, so reported mortality rates within 48 hours of anesthesia are relatively high in avian species. So, what this is saying is that patients who pass away, unfortunately, within 48 hours of an anesthetic death or anesthetic event, are kind of high in birds compared to dogs and cats. So 1.76%, so just under 2% to 4% compared to cats, which is less than 0.5%, and dogs less than 0.2%, and then humans. Um, so a retrospective case series. Yeah, so anesthesia associated mortality rate is 7.7%. So that's really high. That's terrifying. That's a really high number. And again, this isn't necessarily specifying here what these animals' ASA scores are. Like, are these all very high risk patients that are unfortunately dying, or are they all low risk patients? What's going on? So, ASA scores are a pretty useful predictor of anesthetic risk, and we use them routinely in dogs, cats, and our team uses them with exotics. Um, so yeah, just kind of repeating what we kind of know here. So These are all avian patients undergoing general anesthesia between 2017 and 2019. Okay, it's a first opinion referral avian practice. And okay, yeah. So that's okay, so they had 7 surgeons, minimum 2 years experience in exotics only practice. So ranging from general practitioner to avian diplomat. So that's interesting. So I wonder if they looked at veterinary surgeons were not blinded to the outcomes of anesthesia, which is good. You know, if like my doctor couldn't know if her patient lived or died after anesthesia, I feel like she'd be really upset about that and not happy with not knowing what happened to her patient. Um, so it'd be really interesting to know if um, if there was a lower rate of death from the general practitioner compared to the avian specialist, because I certainly know a number of general practitioners that are excellent surgeons. So you don't necessarily have to be a diplomat to be a great surgeon. And I'm sure not every diplomat is an amazing surgeon. There's a lot of human variation in medicine. And I think that's something that clients often don't appreciate, that, you know, doctors and nurses, we're all individual people. Sometimes you might just have like a really bad vibe from a doctor. It's just because your personalities just don't groove. I know some excellent doctors that I've had really bad feedback on from clients, and it's just because their personalities didn't mesh. And then, like, unfortunately, some not so great doctors that clients love, even though they're really bad at medicine. Because unfortunately, some of those doctors just really need to retire. And I'm very comfortable saying that. So anyway, um, I always feel bad when I get unhappy feedback about doctors that I know are really good people and really good at medicine. And sometimes it's really just there's a miscommunication, or there's just like not a there's just a personality mismatch sometimes. Or, you know, vet medicine is really emotionally charged. A lot of clients, a lot of pet owners, I understand you are terrified. You have a sick pet. You're worried about what's going to happen to your pet. You're worried about your vet bill because medicine is unfortunately expensive, and we don't have insurance for exotics in Canada, which we really should. I feel like rabbit insurance is coming eventually, but like, why the hell can't you insure your bird? It drives me nuts. Complain to insurance companies. Ask for coverage options for your exotics. I've been asking for like, oh God, like, I don't know, 22 years so since I was a tech student. Fun anecdote that's a bit off topic. Yeah, I really wish there was insurance for exotics in Canada. When I was a tech student in like 2003, we had like a rep come in and talk about insurance and pets, and I asked about exotics, and she laughed at me. And that was really not okay. That was really douchey of her. Because you know what? A lot of pets would really benefit from insurance for their exotics. Or, sorry, a lot of pet owners would really benefit from having insurance. Um, oh, ran up some serious bills. That really sucks. Yeah, I feel you. I had some sick snakes a few years ago. And it just sucks. It just really sucks to have to pay for sick pets, because you wonder like what could I have done differently. And sometimes things are just accidents. Like, I get it. Paying for medicine just sucks. Like, we all deserve a living wage, and we all deserve to um be able to do good medicine for our patients, but it just sucks that insurance isn't a better option for our exotics. Like, I really push for it in dog and cat patients when I was working with dogs and cats. Um and because it makes such a difference. Like, insurance saves lives. So anyway, we're so back to this. Moving off of insurance. Um, so okay, yeah. So if there was no ASA grade, or if their patient identifiers were just kind of like vague or like not really clear on the record, then they omitted those records, which makes sense. So they did some statistics. Once again, I'm not going to get into the details of statistics. This isn't a math rounds. So the main factor of interest was ASA grade. ASA grades 1 and 2 were grouped together for analysis as there were no deaths in ASA 1, which makes sense. Again, we don't expect the risk is never zero for anesthesia, but we don't expect to have anesthetic deaths in patients that should be very low risk, patients that should be healthy. Other factors considered were sex, age, weight. So again, they didn't compare doing the general practitioner to the diplomat, which is really interesting. Um, So, once again, almost 2,000 records, which is a huge sample size. That's awesome. Reviewed from the 3-year period. They did exclude some records, blah, 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 blah. And oh, wow, patients aging from 4 weeks to 58 years, which is amazing. That's awesome. That's a huge, huge, huge demographic. And then weighing from 14 grams to 9.3 kilograms. 14 grams, I wonder if that's like a finch. um, So they all had inhalational induction and maintenance with isoflurane. Not surprising. Oxygen at varying levels. Okay. So just under 5% died during or up to 48 hours after the anesthetic, which again is it's pretty good considering like a lot of these patients are quite sick. Um, they looked at they're just making like odds of death here, which I don't try to focus too hard on the numbers. I know clients, it's hard because pet owners are always like, I want a number. And it's just there are so many variables. It's so hard to give them a number. But we can pretty safely say, like with a lot of these ASA 5 patients, so the highest anesthetic risk patients, like you can very easily say, like, you have a 50-50 chance to live. If not less than that, unfortunately. So yeah, so they're just kind of going over the stats a little bit more. So this is just kind of just confirming what we knew. It's really great that ASA 1 to 2 had a very, very low number of deaths because I know a big reservation for so many pet owners when we're talking about sedation or anesthesia is this whole stigma that birds die under anesthesia or that rabbits die under anesthesia or that, like they just don't tolerate it well. And that's just not true. So realistically, the problems that we see are because we see animals in much more significant states of illness compared to a lot of our dog and cat patients. So it's not to say that we don't do anesthesia on sick dogs and cats, that happens all the time. But we do so many more surgeries on young, healthy dogs and cats because spaying and castration is routine compared to exotics, where often we're doing sick patient procedures. We're doing like life-saving salvage procedures where your pet is already super sick and we need a procedure or we're going to die from complications. And unfortunately, because exotics are so good at hiding signs of illness, they're often at the point where they probably already have some complications from that disease and we're doing our best to mediate everything. So, ASA scoring is super useful on our end because it helps us kind of quantify or estimate anesthetic risk, even though, again, it's really hard to give exact percentages to pet owners. But it's very, very assuring that patients with ASA grade 1 to 2 had a very, very low risk of anesthetic mortality. That's really what we want to see. That is supporting the idea that birds don't, if you have a staff who know what you're talking about and you're using modern anesthetic protocols, birds don't necessarily have a higher risk of dying if they're healthy animals and you have competent staff who are familiar with the species. And of course, a bit of a captain obvious moment if you have a very unstable patient, whether it is a bird, a dog, a cat, a rabbit, a guinea pig, a bearded dragon. Um, if you have a really, really sick patient, your risk of anesthetic mortality is much higher. That makes sense. So, um, so here we go. The mortality rate in the study of 0.49% in quote unquote healthy patients, so that's the ASA 1 to 2, and then 9.5% in unhealthy patients, greater than previously described in dogs and cats, however, lower than what's reported for healthy rabbits in another study. And again, rabbits like that uterine adenocarcinoma, or sorry, the uterine disease, it's because rabbits are so good at hiding that they're sick. Rabbits are so frustrating. Um, Birds are also frustrating, but rabbits are super frustrating in that you can have rabbits that, you know, are acting totally normal, and then on exam, you find something horrible. So that's unfortunately what happens. Or, your rabbit unfortunately dies out of nowhere, and then you find out that, oh, wow, they had cancer. That's terrible. So, so higher than what we expect for dogs and cats. But again, dogs and cats, we also have much larger patients. We have so much more data on what drugs work and so much better understanding of everything that goes on in these animals. So while Exotic animal medicine and avian medicine, avian anesthesia has come so far in the past 20 years. We're still kind of in our infancy compared to dog and cat medicine, so we have a little work to do. So yeah, this study is really interesting. Again, really great. It's nice to kind of confirm things that we suspect. It's nice to see the numbers so that we can, for our pet owners who really want to know the numbers, then we can, say, okay, well, this one study in 2022 that looked at, almost 2,000 birds found that birds who are healthy generally don't die under anesthesia, which is great. So I'm not going to go over much more here. I'm actually going to call it tonight because I am exhausted. Thank you so much